welcome to the ASMR clinic. My name is Leo, and I'm gonna be conducting a cranial nerve examination on you, okay? And as we go through the exam, I'm gonna be asking you a couple of questions, and also I'm gonna be explaining you what I'm doing throughout the process, okay? Is this your first cranial nerve examination? No? You had one when you were 15 years old. I understand. Perfect. So if you remember it, you know it's not that complicated, okay? All you need to do is to follow my instructions. Awesome. So let's go ahead and start. And let's see. So first, I'm gonna be checking your sense of smell. I want to ask you, have you noticed any change on your sense of smells lately? No? Okay. Have you had any difficulties in the past to identify odors, fragrances? Not at all. Okay. Great. Now I'm gonna get a little bit closer. I want you to please look up, and I'm gonna inspect your nose just to see your nasal extending this side, see that cavity, and of course with the seed of data, and on this side. Okay. Good job. So you haven't had any difficulties in the past to identify smells, like to smell things? Not even when you were 15 years old, back then? No? Okay. Look up again, please. This side. Let's see. Good. Now, before we start with the test, I want to make sure that there are no blocks on your nose. Okay? Now, could you please cover your right nostril and inhale, please, deeply, and exhale. Okay, is there any difficulty there? No? Okay, I want you to do it one more time, please. Inhale with your left nostril and exhale. Great. Now, let's go with the other one. Cover your left nostril, please, and inhale deeply. Breathe in and breathe out. Good. Was there any difficulty there to breathe? Good. Let's do it again, okay? Remember to keep your mouth closed, and cover your left nostril. Breathe in, please, deeply, and breathe out. Good. Perfect. Good. Now I have some fragrances here that you're gonna help me identify. Okay? So we're gonna start with the first one. Let's see. Now, will you please cover your left nostril and tell me, what do you smell here? good. Now let's go with the other side. Cover your right nostril, please, and tell me what you smell there. What is it? That was grapes, yes. Do you notice the same smell on both sides? Do you notice any difference on the smell? Exactly the same. Good. Great. Let's go with this one. And it will be the same, okay? Will you please cover your right nostril and tell me, what do you smell here? Okay, now let's switch. Cover your left nostril. Good. And tell me, what do you smell here? Pretty easy, right? That was coffee. Great. Go another one, okay? And this time you can use both your nostrils, you don't have to cover your nose. This is the last one, and don't cover your nose, okay? Just tell me, what do you smell here? What is it? Yes, that was mint. Good job. Perfect. Now let's move on with the next test. And have you noticed any difficulty to identify flavors when you eat? Yes, usually when you have a cold, you kind of lose the capacity to taste food and drinks. But aside from that, have you had any difficulty, any sudden difficulty to identify any flavors? No? Good. Okay, let's see. Perfect, so we have the first one here, and I'm going to take a sip of this, and then just please let me know what it is, what you taste there. Okay. Yes, that was pineapple. Good job. Let's see, let's go with this one. Okay, it will be the same, okay? Just take a sip of this and tell me what it is. Let's see. Here you go. And yes, don't worry, take your time. Okay? Take your time there. How's that? Chocolate. Tastes good. Glad you like it. Perfect. We have one more. This is gonna be the last one, okay? Let's see. Here it is. Yes. Okay, that last one, yes, was coconut. A particular flavor, I know. It's not very common on this type of exams, but I always like to do things differently, a little bit different. Good. Awesome. So now, since this is the first time you come to the ASMR clinic, I want to update some of the information, okay? So I'm gonna be asking you for your generals and some personal questions. Okay. So let's start. Let's see. Could you please provide me with your full name? Okay, good. How old are you? Good. What's your email address? Your phone number and your physical address. Good, thank you. And tell me, do you smoke? Do you do any type of drugs? Do you drink alcohol? Good. Perfect. And are you allergic to any? Do you have any allergies? Okay, excellent. So now we're gonna go with the visual examination. I'm gonna do an eye exam, okay? Just to make sure that your vision is working good. Let's see. And I'm gonna start by looking at the back of your eyes. Okay, so I'm gonna get closer and I'm gonna shine a light on your eyes. It's gonna be a little bit shiny, okay? So there we go. Great. Try to look directly into a light. Just want to check the back of your eyes to make sure that there is no damage there, and any damage on the blood vessels, the retina, and also the macula. Do you usually have headaches, any type of dizziness, blurry vision? Let's see. Everything seems to be pretty good here. When was the last time you went to see the ophthalmologist? Have you ever wear glasses? Never. Have you ever had any problems on your vision to identify objects either near or far? Never. Okay. That was good. Right. Now I want to perform visual acuity test. Yes, a visual acuity test on you with the Snelling chart. And I want you to please help me identify the letters on line number 5. What letter is this one? What about this one? And this one. Could you please read for me letters in line number 6 backwards? Okay. 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 Okay, perfect. Now let's go with the letters in line number 7, okay? What letter is this? This one. What about this one? Good job. Let's see. Now we're gonna do a cover test. Okay. I want to check how your eyes are working together, okay? And usually your eyes should be moving in the same direction with the same pace, okay? If you please focus your eyes on the light and follow with your eyes. Yes, follow it with your eyes. Only with your eyes, okay? Just like that. Good job. Great. Okay. Just don't lose sight of the light. And try not to move your head, please. Yes, like that. Great. Okay, good job. Let's see. Now, you please focus your eyes on my nose and tell me every time you see my fingers enter your field of vision. Okay. There. Good job. Keep your eyes focused on my nose, please. Great. Perfect. Okay. Good. Now let's do a contrary, okay? Tell me every time you no longer see my fingers. Okay. Good job. Exactly. There. Good. Perfect. Now I'm gonna get closer again. Okay. And I'm gonna use a different tool there. Let's see. Can you please look up? Look down for me. Now to the left. Then to the right. Okay. Good. So, yes, there was something there that I wanted to double check. With the first test, I was not able to completely see what was happening there. Right. Perfect. So we're gonna move on now, okay? We're gonna do facial sensation test, okay? And for this test, I want you to please close your eyes. Okay, close your eyes. And for this test I have two objects, one soft and the other one is sharp. Okay. I want you to please tell me every time you feel the soft or the sharp touch. Okay. Remember to keep your eyes closed, please. Tell me, what do you feel there? Soft. What about this? Was it soft or sharp? And this. Was that soft or sharp? Good. What about this? Soft or sharp? Good job. Was that soft or sharp? Okay, perfect. And this. Soft or sharp? Good. So far so good. Now let's check your facial expressions, okay? You please raise your eyebrows. Smile big for me, please. Close your eyes tight. Wink your left eye. Now wink your right eye. Okay, pop your cheeks. Perfect. Now to finish it up, I'm gonna be using my gloves, okay? And I'm gonna be touching your face, your head. Let's see. And we're gonna continue with this one, okay? Let's see. You close your eyes again, please. And tell me, can you feel the same pressure if I touch you here and here? Okay. What about here and here? Good. Now, what side of your head I'm touching? Is that left or right? And what about this one? What side of your head I'm touching? Left or right? Okay, good. Do you feel any pain if I touch you this? And if I do this, do you feel any pain? So too. What about this? Do you feel any pain there? And here. Okay, good. Now I'm gonna touch your head, top of your head. If I press here, do you notice any pain? Any uncomfortableness? No? What about here? Any pain at all? Good. Let me check if there is any asymmetry here or bump on your head. Okay. And on your neck, under your chin, see if there's any nodes, inflamed nodes there. And on your neck. Good. Perfect. So I think overall you did pretty good. You did amazing actually. So there's nothing to worry about. I know you wanted to follow up on this to make sure that everything is good. And in fact, yes, everything is perfect. Okay. Great. Good. So with that, we have come to the end of the cranial nerve examination. It was a pleasure for me assisting you today. Exactly. Hope to see you soon. Great. Oh, and before you go, I want to ask you if you like the video, if you like the content on the channel, please go ahead and subscribe. I would really appreciate it. It will mean a lot to me. And I also wanted to let you know that we have a Spanish channel in which we have more than 100 videos. So if you want to hear me speaking Spanish, you can go over there. You can find the link in the description below. And I'm also working, I'm sweating a lot, sorry. I'm also working on a vlogging channel. Once we hit 100 subscribers, I will be posting the first video. So for that one, you can also find the link in the description below. Thanks a lot for watching. Take care. See you soon.